Welcome to the 17th Annual Stockton University Physical Therapy Program Commitment to the Profession Ceremony, honoring the class of 2024. I am Tom Nolan Jr., Professor of Physical Therapy, and I'll be your Master of Ceremonies for today. Now, let's welcome to the stage the Stockton University Physical Therapy Program Class of 2024. Joining us for this ceremony today, and please stand when I call your name to be recognized, Stockton University President Dr. Harvey Kesselman. Provost and Vice President for Academic Affairs, Dr. Limor Kahanov. Dean of the School of Health Sciences, Dr. Brent Arnold. Assistant Dean of the School of Health Sciences, Dr. Lee Bryant. President of the New Jersey American Physical Therapy Association, Megan Gardner. Professor of Music, Dr. Beverly Vaughn. Associate Provost, Dr. Ariane Newman. Simulations Lab Coordinator, Ken Davis. Physical Therapy Faculty, Program Chair, Dr. Patricia McGinnis. Dr. Leanne Gunther. Dr. Mary Lou Galantino. Dr. Alicia Mastrangelo. Dr. Rob Marsico. And joining us via Zoom on family leave, Dr. Lauren Del Rossi. Dr. Matt Roman. Dr. Rania Almajid. Dr. Jeffrey Snyder. Professor of Biology, Dr. Melissa Zwick. And joining us today, we have the founding chair of the Physical Therapy Program, Professor Emerita, Dr. Bess Catherines. And also joining us by Zoom from her home in Georgia, Professor Emerita, Dr. Elaine Bukowski. Dr. Kesselman?
You nervous? Huh? You enjoying it? Good. Good afternoon, everyone. Good afternoon. Give a great round of applause for all the moms and dads and families and parents and everybody out here. Good afternoon, and thank you for inviting me to take part in this special celebratory occasion. Since announcing my decision to step down as president of Stockton, these moments when I have the opportunity to address our faculty, our students, family, and friends are incredibly bittersweet. I remember how well excited we were when the physical therapy program began in 1988. 1988. And I was sort of old then. Can you imagine what I am now? At that time, there was no School of Health Sciences. It was called the Division of PROS, which was short for Professional Studies. Dr. Vera King Ferris, my mentor, was the president, and back then I was the vice president for student affairs. And as you just heard, that person, and I do want you to stand up, Dr. Bess Catherine was your first program coordinator. She actually came in '85 and started the entire program. Give her a big round of applause. In those days, the classes were held right next door at the Bacharach Institute for Rehabilitation and the Atlanticare Medical Center. And now we have the John F. Scarpa Health Sciences Center, equipped with state-of-the-art classrooms and a patient simulation suite. Our wonderful faculty, and they really are tremendous faculty, dedicated and committed faculty, and have been since the day I've met all of them. And our beautiful facilities are symbols of Stockton's promise to provide each and every one of you with a solid educational foundation. And this afternoon, some 35 years later after we began this program, we continue our commitment to you, our second-year physical therapy students, as you take the next step in your clinical education. The pledge that you will take this afternoon and the esteemed white coat that you will receive, witnessed by the many here today as well as those on Zoom, is an important milestone in your journey towards becoming skilled and compassionate healthcare professionals. As you embark on this next phase of your education, I want to congratulate you for the hard work and dedication that have brought you here to this point. The white coat that you will receive today is a symbol of your demonstrated commitment to the highest standards of professionalism and patient care. It represents the trust that patients will place in you and the responsibility that comes with that trust. The trust serves as a reminder of the importance of ethical behavior, empathy, and compassion as you work with patients to help them achieve their goals. I'm sure today's keynote speaker and Stockton alum, Dr. Erin Pizzolata, will agree. Did I say that right? It used to be Rasmussen, wasn't it? What? Okay, gotcha. Forgive me. But I got it right, and that's important for it. Will agree with me, and she will agree with me, when I say that the road ahead will not always be easy. There will be challenges, there will be setbacks, and moments of self-doubt. But remember, you are not alone. You have the support of your professors, your clinical instructors, and your fellow students. You have the knowledge and skills you have acquired over the past 2 years, and you have the resilience and determination to overcome any obstacles that come your way. I wish each and every one of you the very best as you take this next step. I am confident, 100% confident, that you will rise to the challenge and make a positive impact in the most rewarding field. Congratulations, and may you wear your white coat with pride and honor. And on behalf of the Board of Trustees, the alumni, the faculty, students, and staff of Stockton, kudos, congratulations.
So, firstly, President Kesselman, we would like to thank you for your remarks to our soon-to-be entering first year Clinic 1. Dr. Catherine, thanks for joining me. We would like to thank you, President Kesselman, for tireless service and dedication to our School of Health Sciences, formerly known as Professional Studies. Leading under the guiding principle of students first, Dr. Harvey Kesselman is our 5th president and passionately dedicated more than 4 decades to our Stockton home. He witnessed the evolution, as he described so beautifully, of our Bachelor's of Science in Physical Therapy with our founding director, Dr. Bess Catherines. He helped to walk us through the master's degree, and then finally to what you will be receiving in 2024, which is your doctorate in physical therapy program. During his tenure in these various positions, he was integral to our success of our most recent re-accreditation in 2021. So I want to definitely acknowledge his role in that guiding process. And because I love a quote about leaders, I would like to state a true leader has the confidence to stand alone, the courage to make tough decisions, and the compassion to listen to the needs of others. He does not set out to be a leader, but becomes one by the equity of his actions and the integrity of his intent. And that's by Douglas MacArthur. And Dr. Kesselman has been an ardent supporter of our program through his various roles, so he just emerged into these roles as Dean, Vice President for Student Affairs, Interim Vice President for Administration and Finance, Provost, and Executive Vice President. In his many-faceted roles, he extends his reach to this entire southern New Jersey area and community and throughout the state of New Jersey and beyond in his national presence. For our DPT students who took their journey through undergraduate programs, Dr. Kesselman supported all aspects of student scholarship and resources, which has culminated in our John Scarpa building with state-of-the-art anatomage and simulation experiences. So for all of you in the audience who have not been to our new building, please take some time today and explore. He was recently awarded the Man of the Year Award by the Friendly Sons of St. Patrick. Just want to point that out. Doctors Gunther and Mastrangelo and myself witnessed another honorable moment. And what was so impressive is that he wasn't there just to be honored, but he wrapped it around the fact that he stood there to witness more scholarships for high school students that were potentially coming to our university. So that is that student-first commitment and their first steps from high school to where you are sitting today. Leadership and learning are indispensable to each other. And that is what our president embodies. And on behalf of the DPT program, our director, the faculty, our emeritus professors, the alumni, and our students, you, Dr. Kesselman, are indispensable. And we graciously thank you for your service and forever grateful for your support of the program. There you go. You're good.
Thank you so much. I will treasure this for the rest of my life. Thank all of you, too. They deserve a heck of a round of applause for the work that they've put forth up to now. So give them a big round of applause.
Dr. Arnold?
On behalf of the faculty of the School of Health Science, let me welcome you all as the students, your families, and guests here this afternoon. Also, thank you all for the opportunity to visit with you on this important occasion. I want to extend my congratulations to you for this milestone. This ceremony represents a significant advancement in your career, and you should be deservedly proud of this step. I come from a health profession that does not wear a white coat, and therefore a white coat ceremony is not part of our typical practice. However, from personal experience, I have learned to value traditions and to understand the importance of initiations and bonding individuals to each other and together for some greater purpose. As you cross this threshold and move forward with your careers, I would ask you to spend some time reflecting on the why of this step. The why for most of us is that we entered healthcare because we enjoyed helping others. That means that for most of us, we are very comfortable playing the behind-the-scenes role. However, the past several years demonstrate that that's no longer true. We now have a better understanding as a society the critical importance of all healthcare workers and the role that you all play in our healthcare system. Healthcare is very much front line. So as you put on your coat today, please know that the school's faculty and the community at large appreciate your willingness and motivation to step into this role. Thank you for all you do and all you will do, and congratulations on this next step.
Our next speaker is Megan Gardner, President of the New Jersey American Physical Therapy Association.
Hello, everyone, and on behalf of the professional organization, welcome and congratulations to all the students here today, and of course, welcome to families, friends, and enthusiastic supporters. We are here today to acknowledge these students' work with dedicated professors and celebrate their progress as they move forward towards clinical education. You all are, see, I can claim I'm from Texas sometimes, so y'all are continuing down the road into a profession that is well respected and dynamic. It's based in the art of healing, the science of movement and body systems, and continuous learning. It's a profession with a vision of transforming society by impacting the human experience. And you will be an integral part of a larger healthcare system that is undergoing constant change. You're being asked to move out of the relative comforts, that's a joke, of academia and into the role of a healthcare professional. Many people will be offering you advice during this time of transition, and I get to be one of the first. So here are a few thoughts for you as you start looking forward to your clinical education rotations and move towards graduation and your transition towards being a healthcare professional. Number one, it's a list. Your skills, abilities, and techniques will and should continue to evolve. Be present with your patients and hear what they're saying and actively listen to what they are telling you. In school, you are actively learning, but the synthesis of that learning is different than being in front of a patient or client with a healthcare issue. Hear the deeper story and look to advocate for needs that are unmet. The American healthcare system leaves many with unmet needs: mental health, poor health literacy, high copays and deductibles that make people's healthcare a financial decision between care and day-to-day necessities. And so think about how you are going to be part of their journey towards wellness. Watch and learn. Hold on to your best practices that you've learned here. You probably know more about recent literature, clinical practice guidelines, and best practices than many of the seasoned clinicians you will be interacting with over the next year. However, they have learned how to make intuitive leaps due to experience and know where clinical resources are, and will help guide you on your journey from a new clinician to a seasoned one. And in that case, share your knowledge. Bring what you have learned into the clinics. Physical therapy is a collaborative profession. As knowledge in clinical care is elevated, everyone benefits. And just recognize that there will be holes in your knowledge. No DPT program can bring you to the level of an expert, and that's not the expectation. You will be a new clinician, and while your brain already feels probably pretty full, Fill the gaps as you find them, and use your professional resources to help find where your knowledge and your needs need to be improved. Number 2, network, network, network. Continue to learn new skills. I work at a large outpatient clinic with occupational therapists, lymphedema therapists, pelvic therapists, GCS, OCS, pain specialists. And as you grow a network of clinicians with different skills and possibly from different geographic areas, you broaden your reach and your ability to meet not only your needs, but the needs of your patients. Meet new people. I am not a joiner, but I like to say yes. But I would be content with sitting in a quiet corner with a book. But I would never be here in front of you today if I didn't say yes to meeting people, and I didn't say yes to volunteering with the APTA-NJ, and I didn't say yes more than once to serving as president. And I said it twice. So continue to say yes. Go to the meeting, get involved, go to the course, talk to the people, try a new area clinically. Ask the clinicians at your office if there are specialists in the system or that you can observe, and it might change your outlook, it might change your life, and it will bring you experiences that you could have never possibly conceived of. And last and certainly not least, be engaged with your profession. We are stronger and better together, and a larger voice leads to larger change. APTA-NJ, APTA-PA, APTA National, the sections, all offer opportunities for networking, volunteer experiences, and member discounts. Mentorship is another opportunity that's available with a professional organization. APTA-NJ has a new professionals special interest group designed for people who are transitioning out of academia and into clinical practice. So opportunities to learn new positions, new skills, like those are all available to you. And leadership opportunities. So chapter, section, APTA National, all have opportunities for new professionals to be involved, to encounter leadership opportunities, to be mentors to, students who are going through PT programs right now. And you may even want to consider a clinical residency after graduation to continue to grow your skill sets and continue to network. Advocacy is an enormous part of our profession, and it doesn't get talked about a lot. And people get bored when you talk about advocacy a lot. But legislation and political action are part of how we protect and push our profession forward. There isn't a single physical therapist in the New Jersey legislature. So how many of them have experience with our service and what we do and how we work with our patients and what our skills are? So be a member, donate, be involved. It's all really important to your professional and personal growth. And so on that note, I'm going to wish you all the very best of luck in the future, and I hope you all go forward with passion and empathy. And I said compassion, but that kind of just streamlines into passion. So thank you very much for having me. It was wonderful to see all the smiling faces, and best of luck with your clinical rotations.
Our keynote speaker today is Dr. Erin Pizzolatto. Erin is a 2013 graduate of Stockton University's 3+3 physical therapy program. Erin has more than 8 years of experience as a physical therapist in outpatient office settings, including 5 years as the office clinical director. She has provided physical therapy for people with orthopedic, neurologic, developmental, and traumatic injuries, including children and senior citizens. During this time, she enjoyed completing continuing education courses to expand her manual therapy skills and learn new exercise techniques. She is a certified therapist for the LSVT BIG program, which provides specialized therapy for people with Parkinson's disease. In November of 2020, she became a mother and took a leave of absence for 14 months. and she's currently providing physical therapy in the home care setting, where she enjoys the one-on-one time with her patients and promoting patient independence in their homes. Dr. Pizzolatto.
Thank you, Dr. Nolan. Thank you for having me here today. It's truly an honor. Today we are here to celebrate you, the Stockton class of 2024, as you get ready to enter your clinical experiences. You all have spent countless hours studying to understand the body, how to address musculoskeletal dysfunctions, and from experience, I can say that this program has prepared you well. I myself celebrated my white coat ceremony on this very campus over a decade ago. I remember the anticipation and the excitement of that day. My first clinical experience was amazing. I became much more confident in my own knowledge, practiced manual therapy skills, learned some tricks of the trade, and developed relationships that I maintain today. But I'm not here today to speak about my clinical knowledge. I'm a Stockton PT graduate with 10 years of experience, and I do believe that I've done the best that I can for my patients. I don't, however, have any special certifications or acronyms after my name. I'm not here to tell you how to practice. You will have been prepared to do that through your classes, your clinical experiences, and all of those continuing education credits. You will be well prepared for how to treat your patients. What I hope to do today is to share some perspective to help you shift a bit from the very clinical, medical-based mindset it's so easy to slip into early in your career. The mindset of thinking about the diagnosis rather than the patient. I hope to remind you of the humanity of the profession, why most of us decided to be here in the first place. I graduated from Stockton's physical therapy program in May of 2013 and completed my last clinical affiliation July 3rd of that year. It was 1 month and 2 days later that my entire life changed. I was in an accident which resulted in a fracture of my L2 vertebrae. Immediately, I was unable to feel from the waist down and knew that I had been seriously injured. At the hospital, my symptoms progressed to paralysis, and I was diagnosed with a spinal cord injury. I underwent surgery the next day. The initial days following my injury were a blur. Family and staff in and out of the room while I self-medicated with patient-controlled morphine drip. I fully understood the extent of my injuries, and I did not want to deal. This wasn't how it was supposed to go. I was not supposed to be the patient. I was supposed to be treating bedside. During the following days in the hospital, a lot was processed by myself, my parents, and my boyfriend of 2 years. Spoiler, he's now my husband, and over there with the chatty 2-year-old. One thing I think most about was how my doctors and the staff handled their discussion of my condition in those early days. She is young and strong, we just don't know. She has the knowledge and she has determination. These uncertainties were a lot, and while they were not what we wanted to hear, they were what we needed to hear. We understood in no uncertain terms I may not move or feel below the waist again, but we also understood that there was hope, and they didn't take that from us. What I want you to remember is your patients with any type of injury will be coping with how this change will affect their life. Their independent ADLs, their functional mobility, right? In other words, how was I at 23 years old going to return to normal life when I now needed assistance to shower? I couldn't drive. I couldn't stand up to hug my family or my boyfriend. That was the thing I missed the most, a good standing hug. Now, you will be the people who help to give these patients their lives back, who make all of these things possible again. Not everyone is guaranteed a full recovery. Unfortunately, that's not always up to us. But you will have the tools to help them overcome and adapt. Their goal, like ours, is to return to prior level of function, who they were before. They want to be defined as a person, not as their condition. This seems like a small distinction, but the way we speak of our patients daily dictates how we address them in their treatment. I am a person with a T12 incomplete spinal cord injury, not a T12 SCI. Your patients live full, complete lives before they went into for their knee replacement or their rotator cuff repair. Let's continue to address them that way. As someone with a TKA, someone with an RCR. As the provider who will see patients more often than any other medical practitioners, we get the honor of really getting to know them. Your patients will talk to you, and you will learn things from them about their lives and about their condition that they don't tell anybody else. Some of these things will inform your treatment, and some will require referral back to the doctor, but they will talk to you, and if you listen, you will begin to understand them and what is most important in their lives. You will begin to understand, but remember that you will also never understand. This is important. We can all sympathize with our patients. However, each person experiences things very differently. I have worked with people of comparable diagnoses to mine, but I cannot imagine what their experience was like. These were parents. They were out of work with medical bills. They could not lift their children or get on the floor to play with them. I had no idea how difficult that might be. My family and I quickly learned, while I was in the hands of very capable and caring medical professionals, we needed to be advocates. Throughout my recovery, I constantly provided my therapists and physiatrists with updates, asking them to push me. Each morning, I would scan from hips to toes to see what else I may be able to move, what I have more control over. If I felt that I noticed something new, I would tell my therapist, and she'd say, "Great, let's work on that today." She was amazing, but it was not her responsibility or fair to expect her to assess strength and movement on every part of my body, waist down, every visit. I had to communicate that to her. And her being open to these conversations truly made all the difference. Kara was my therapist. She brought concerns up about my pain level to my doctors. For 2 weeks after my surgery, I was unable to sit up without searing pain from my back to my toes. This prevented me from participating and attempting many important pieces of my therapy. After that meeting with my doctor, I was quickly diagnosed with nerve pain and given medication. 1 day later, I was sitting up pain-free because of Kara. That was life-changing for me. At the end of the day, we could be the most knowledgeable therapists with the most beneficial interventions and a foolproof plan of care. But if we don't make a connection with our patients and they don't buy in, the treatment is not going to go anywhere. We must empower our patients to take that knowledge and implement it into their daily lives. The cruel reality is we will not always get to dictate the frequency or duration of our patients' treatment. My own experience was I was seen an inpatient for 13 days, followed by 6 weeks in acute rehab before I was discharged home as a functional paraplegic. For a spinal cord injury, I was in outpatient PT twice a week from the end of September 2013 to mid-January. After that, my insurance approved 2 visits at a time, and then, although my therapist fought for more, I was discharged in February. I remember my therapist, Maureen, telling me that during a phone call with the insurance company, she implored, she's 23 years old. What is she supposed to do if she's crossing the street and a bus is coming? What if she has a child one day that she needs to run after? She convinced insurance for 2 more visits to progress to a running program. In total, I got about 4.5 months of treatment before I was cut off. With my background of knowledge from the PT program and my therapist communicating and teaching me, though, it empowered me to take my responsibility for my recovery and keep going after I was discharged. This has been an entire life-altering experience of information. And I know it feels like a big responsibility. And to be honest, it is. But if you remember these very basic human needs, you will do just fine. Our patients want to be seen for who they are. They want to feel that we are listening. They want to be involved in their treatment. And they want and need us to point them in the right direction and give them the tools they need when we can't be there. If you approach each day in treatment with an open mind and line of communication, not only will your patients benefit, but you will too. Congratulations and good luck to our colleagues, the Stockton PT class of 2024.
It was a really powerful journey, and I'm not going to cry as we relive that. But one of the things I want to say to you is sometimes we have the profound privilege of meeting our patients and clients on the worst day of their life. And the ability to hear them, listen to them, be part of that journey, guide them, push them, is really why we do what we do. And so I think you've heard an incredible story. I can't think of a better example of resilience and determination. Your journey wasn't the one you planned. And I remember conversations, you're like, it's not supposed to happen this way. You're right, it's not, but it did. But what do we do now? And so I think that mindset and the ability to each day take each challenge is really so key. And we all have that profound honor to be part of that journey for all of our patients and clients. So on behalf of the physical therapy program, we would like to recognize your keynote address to our commitment to the profession ceremony for the DPT class of 2024. Congratulations, Ryan. Thank you so much for being here.
Guy's got a drink. Now it's time to honor our students with the ceremonial donning of their white coats in recognition of completion of almost 2 years of classroom study and the beginning of their clinical education. When I call your names, students, please come forward to the front of the stage here. And if I could have the 2 faculty donners. From Egg Harbor Township, Amina Bukov. Amina serves as community outreach for the Graduate Physical Therapy Club. From Collingswood, Zachary Billy. Zachary is a member of the Graduate Physical Therapy Club and a member of the American Physical Therapy Association. From Barnegat, James Bakken. James is a member of the Graduate Physical Therapy Club. From Rahway, Chris Marie Castellano Lopez. Chris Marie is a member of the Graduate Physical Therapy Club. Gotta get those hugs in. From Brick, Dominic Sensi. Dominic is interested in sports and neurorehabilitation, and he's a member of the Graduate Physical Therapy Club. From Whiting, Hunter Clayton. Hunter is an ordained minister and a member of the Physical Therapy Club. From Bridgeton, Jody Cook. Jody is a member of the Graduate Physical Therapy Club. From Dorothy, Haley Elias. Haley is the secretary for the Graduate Physical Therapy Club. From Jersey City, Tia Evangelista. Tia is a member of the Graduate Physical Therapy Club. From Sparta, John Kenneth Fabiani. John is the class representative. He's a graduate assistant for Dr. Mastrangelo, and he's a certified strength and conditioning specialist. From Middletown, Delaware, Rachel Danielle Folman. Rachel is a member of the Graduate Physical Therapy Club and the only out-of-state student in the class of 2024. From Phillipsburg, Hallie France. And Hallie is a graduate assistant for Dr. Mastrangelo. From Cinnaminson, Jacqueline Godwin. Jackie is the Physical Therapy Club treasurer. From Manchester, Kelly Herman. Kelly is a member of the Graduate Physical Therapy Club. From Toms River, Edwin Hernandez. Eddie ran the class of 2025 anatomy and kinesiology labs for Dr. Almajid. From Elk Township, Stephen Hill. Steve is an RA. He's been serving upperclassmen students for the last 4 years. From Sicklerville, Cassidy Hogan. Cassie serves as a graduate assistant for Dr. Galantino. From Mays Landing, Anna Lim. Anna serves as the president of the Graduate Physical Therapy Club. From Newark, Danielle Lynch. Danielle is a member of the Graduate Physical Therapy Club. Uh-oh. From Deptford, Kaylee Nolan. Kaylee is a member of the Graduate Physical Therapy Club. From Jackson, Rachel Notiro. Rachel is a member of the Graduate Physical Therapy Club. From Sicklerville, Abigail Ortiz. Abigail serves as the graduate assistant to Dr. Mastrangelo, and she is the social media chair for the Graduate Physical Therapy Club. From Hamilton, Julia Quick. Julie is the Rules and Regulations Chair for the Physical Therapy Club. She's a graduate assistant for Dr. Del Rossi, and she has a 7-month-old golden retriever named Buddy. From Linwood, Josephine Rundle. Josephine has been a firefighter for the Summers Point Fire Company No. 2 since March of 2020. From Hopewell, North Runk. North is a member of the Graduate Physical Therapy Club, and he's a graduate assistant for Dr. Nolan. From Egg Harbor Township, Zanab Shuja. Zainab is a member of the Graduate Physical Therapy Club. From Franklin Lakes, Corinne Schustic. Corinne is serving as the Community Outreach Chair for the Graduate Physical Therapy Club for almost 2 years. From Deptford, Nicholas Sisto. Nick is a member of the Graduate Physical Therapy Club. From Linwood, Sean Taylor. Sean is a graduate assistant for Dr. Mastrangelo, a trustee for the Dean Randazzo Cancer Foundation, and a surfer for the Absecon Island Board Riders Club. From Spring Lake Heights, Matthew Thurman. Matt is a member of the Graduate Physical Therapy Club. From Woodbridge. You're right. Jared Mark Tolley. Jared is the event coordinator. You got it there? He's the event coordinator for the Graduate Physical Therapy Club. He's a graduate assistant for Dr. Snyder. And he describes himself as a mediocre piano player. From Lincroft, Julia Wimkin. Julie is a member of the Graduate Physical Therapy Club. Now I'd like to call class representative Johnny Fabiani to the podium. Copy here. Set. Perfect. All right. Remember. Pause. Got it.
In the presence of my classmates, family, friends, and faculty gathered here today, I solemnly and willingly dedicate myself to providing the highest quality care and services. I solemnly pledge I will respect the rights and dignity of all individuals who seek my services or with whom I work, act in a compassionate and trustworthy manner in all aspects of my services, exercise sound professional judgment while abiding by legal and ethical requirements, demonstrate integrity during interactions with everyone for the enhancement of patient care and the advancement of the profession, enhance my practice through lifelong acquisition and application of knowledge, skills, and professional behavior, participate in efforts to meet physical therapy and healthcare needs of local, national, and global communities. Thus, with this oath, I willingly accept the duties and responsibilities that embody the professional of physical therapy.
Now we're going to find out if that self-described mediocre piano player can actually play. I'd like to call to the piano Jared Tolley. Oh, mediocre, huh? Oh, good. Well, that concludes our ceremony for today. I'd like to thank everyone for coming today, especially like to thank our speakers. I also like to thank Stockton Production Services and IT, Lisa Warnock in the Event Services Office, the School of Health Sciences, in particular Nora Kennedy, Haley Hedgerek, and the student ushers, who I believe are still here from the class of 2025, Greg Souza and Agnes Cancio. Thank you. Thank you, everyone. Please join us outside the theater to your left for refreshments, and I know the faculty would love to meet everyone who's here today. Thank you for coming.